actually my first choice when I was selecting residency programs, and I was really attracted to the city of Kingston. I think the quality of life is really high here. I walk to work and back every day. I'm never stuck in traffic. I'm close to great restaurants and cafes. I see people I know around the city all the time, lots of parks and outdoor space. It's a great place to live. And I was also attracted to the program. I had heard really good things about it. A lot of the psychiatrists I had worked with in medical school encouraged me to apply to a smaller program because you get more individualized attention and you can really tailor your experience based on your interests.
In psychiatry, it's such a difficult specialty kind of interpersonally, and I mean, if you're doing it properly, you should be feeling a lot. So to have your colleagues as friends to bounce things off of has been like special, and it couldn't have been the same at a larger program. There's other advantages of our larger programs, but that part can't be the same. That's the way it is at Queen's.
We get a lot of one-on-one training with staff and the residents, so oftentimes in my clinical rotations I will work directly with a staff who can give me quite a bit of feedback, and I think that has really helped my learning over the time here.
We have a good faculty to resident ratio, and so our residents in some way will get more individual training or education, so in some way it can be seen as like private tuition. So they get more one-to-one training, they get to know different faculty supervisors, they have an idea about different research projects going on and which supervisor to work with. Overall, I think it's the people we work with, whether it's residents, faculty, administrative staff, so it's a very collegial environment, a very friendly environment.
So the way we structure our program is in PGY1, you spend 4 months doing psychiatry rotations. I spent the first 4 months of my residency doing a block, so 1 month of inpatient psychiatry. I spent some time with the first episode psychosis program, which I loved. I spent some time with child psychiatry and also in emergency psychiatry. So it really gives you a good foundation. Your first 4 months in residency of the program you're going to be in gives you a few different experiences. For the rest of your PGY1 year, you rotate between different specialties in medicine. So you do some emergency medicine, some family medicine, internal medicine. I did a month of pediatrics. I did a month of acquired brain injury. The rest of the PGY1 year is spent exploring different types of medicine, and it's really a great experience because you get to know residents in all these different parts of the hospital, and you get comfortable with how different teams work.
One of the things that I have liked about psychiatry, particularly in conducting psychotherapy, is really getting to know a patient quite well, and the rewarding part about that is that sometimes our initial impression of a patient or a person is quite different than how it is over the long term. And I think that's a really special kind of connection to have with a person and a patient.
The field of psychiatry is everywhere. It's everything. It's this moment right now. It's next moment. It's everything, and it encapsulates kind of everything in life, or it can if we want it to. So for me, it does.
I love my job. I find the clinical work endlessly fascinating. You know, one of the really big differences with psychiatry is that every patient really presents differently. No two depressions are the same. No two patients who present with anxiety symptoms are the same. So it really keeps the work challenging and refreshing and fascinating.
The thing that isn't like really understood is that psychiatry can mean like tons of different things. You can work in a hospital, or you can never go to the hospital. You can work at an office and see patients who lay on the couch, or you never have to do that. So certain aspects probably are suited to certain medical students, but really it's kind of open to everyone. If you enjoy looking at like, why do people do what they're doing? Why am I feeling what I'm feeling right now? Then psychiatry is kind of for you.